Thank you for joining me. Today I'm going to do a case history on a patient who ended up having Lyme disease, a 57-year-old male that came in, fibromyalgia, chronic fatigue, I'm sure you've heard this many times, but premature dementia. Think about that. So his memory issues and problems. So he started not feeling well about 2 to 3 years ago. He had a lot of fatigue, weakness, lethargy, pain, right? The symptoms were there, but didn't know what was causing it. Went to 8 different specialists. And they at the end of the day, the best thing that someone came up with was a wheat allergy, which, by the way, when you remove gluten, people get improvement. He did remove gluten and had a little bit of improvement, but he had Lyme disease, and that's the key, the tick-borne illness that was difficult to treat. So what do? We found the infection, and we began an extensive treatment to go after the infections. We have about 80% improvement in overall symptoms, and we did all of that in an 8-week period. Now that's not untypical for us, okay? And what you'll see is that people will be under treatment for years, months, many different doctors, and a little bit of improvement, or you're gonna take 5 years to get better. It's because of the way our infusions and our treatments work. They're targeted to the patient, they're fixing the deficiencies in the patients, rebuilding immune system, all through intravenous care, targeted to the patient, and guess what? Memory improved. And you'll see here all the symptoms improved. Over 25 diagnosed symptoms, 19 totally resolved, 5 had improvement, and only 1 remained unchanged. So this gives you an idea of what's possible when you get all the infections treated, not just the Borrelia. Many of these patients have multiple infections, reestablish the immune system, and treat the patient with proper care. We've been doing this for 17 years. I think we're one of the top in the country. You know, am I saying that? I'm saying that as objectively as I can, because we see these patients after they've been everywhere else, and we've had very good success with our patients. So I want to encourage you that there is something you can do with Lyme disease, with fibromyalgia, autoimmune diseases. We've been able to help many patients. Please reach out to us. We have lots of educational materials to help you or a loved one. May God bless you on your journey to healing.